Ladies and gentlemen, first of all, let me thank you for appreciating my maiden video on sex after 60. I'm honored by the response and comments. One of the points that some men have raised was, Doc, I'm ready, but my partner is not. Now, that's a very genuine problem. And let's look at it from the female's perspective. And to do that, I have the first Indian female sexologist in India with a fellowship from Mount Sinai, Madison, USA, in cognitive behavior and management in sexual health. Welcome to the channel, Dr. Sharmila Majumdar.
Thank you so much, sir. I'm humbled and honored to be a part of this discussion.
Great. Now, you have a paper on sexual life after menopause in women, which was published in Midlife Journal.
Yes.
And it's got very raving views, I understand.
It has won the award for the original paper just 2 weeks ago, sir. So
wonderful. Congratulations. I've gone through the paper and it's an excellent commentary on postmenopausal sexuality in women.
Thank you so much, sir.
Now, can you tell our viewers in lay person terms the gist of the paper?
Absolutely. So the paper is all about the attitude of the Indian women towards their sexuality post-menopause. And also we've done a comparison analysis of the perimenopausal section of women to the postmenopausal section to get a much more clearer conclusion as to how the post-menopausal women, their attitude is towards sexuality and the reasons why. So basically, menopause is associated with, as you very well know, physical and psychological and changes that may lead to sexual dysfunction on its own.
Dr. Sharmila, what is the average age of menopause in Indian women?
In India, sir, it is between 46 to 50, sir.
Okay. Sorry, please carry on.
So the scientific research in the area of menopause and sexuality in India is absolutely scant. There is absolutely nothing. I guess that's another reason why we won the original paper award also. And so therefore the study is aimed to investigate female sexual function at menopause and determine the association between the socio-demographic and the physiological and psychological factors with sexual functioning. We based it on a few things like the response of the lady after menopause, the desire, the libido, the orgasmic factor, and the partner. The inclusion criteria was again monogamous relationships. This was a pan-India study of about 250 women, menopausal women, and perimenopausal women, about 240 women. So it was initiated in Hyderabad. It's a hospital-based controlled study, and it's panned over to 9 other states of India. So it's a pan-India study. It has been done by 9 years and we've got the fruit of labor now.
Wow, that's a decade you've been working on it.
That's a decade. I conceived my daughter after I initiated the research and now she's 9 years and I've now got the award for it. But I am very, very elated.
No, you haven't. You haven't. It's your daughter who's got the award.
Absolutely. Absolutely, I'm sure. So again, coming back to the research paper, it's very simple. Like unlike puberty in India, menopause is generally perceived as a very hushed experience that the woman must suffer all alone on her own.
Okay.
Cultures consider menopause as the cessation of sexual activity or makes the lady asexual. And sometimes women with negative sexual functioning during the menopause and aging process, they are more likely to experience sexual dysfunction with greater intensity and also are more vulnerable to health problems. Because you see, sexuality is a very big part and transiting into menopause, it's a life-changing event for a lady and she undergoes a lot of issues which I will talk about.
Sure.
Because menopause is about drastic physiological and psychological changes. The declining estradiol levels at menopause bring physical and changes too, which can impair sexual functioning, desire, and responsiveness. So this is by nature, given by nature. There's nothing that the lady is doing. So this is an aging process.
Dr. Sharmila, tell our viewers, is there any difference in the type of sexual dysfunction women have in the early age group versus post. I'm talking about lubrication problems. I'm talking about desire
Absolutely, there is
problems.
a lot of difference because the major hormone is missing, which plays a lot of role in vaginal atrophy, for instance.
So we're
Vaginal
talking about post-menopausal.
Menopausal women, they undergo vaginal atrophy, and that is because of low estrogen in the body, declining levels of estrogen in the body. That causes a lot of dyspareunia. It causes a lot of urgency, leakages, even during coitus. So they're really bothered by a couple of these factors. So the perimenopausal group of women did not undergo all these symptoms. So definitely there is a difference. As I told you, the female hormone has a role to play.
Right. So in the younger age group, it's a desire that's a problem.
Yes,
Maybe
but
because
it is not. That is due to probably some psychological or interpersonal or marital issues. But for menopausal women, it is majorly a biological process which is going on.
We'll talk about what we can do for it later in the video. But tell me, what are the problems that women face apart from lubrication problems that we have?
Right, sir. It includes urinary incontinence in terms of leak, in terms of vaginal dryness, discharge, itchiness, then loss of libido, orgasmic dysfunction, dyspareunia, and very decreased sexual desire and sexual activity.
Now, dyspareunia for the laypersons.
Yeah, that is pain in the vagina due to the thinning tissues of the vagina. During menopause, the vaginal tissues thin and it becomes dry. The lubrication is inadequate. And therefore, during coitus, women experience a lot of burning and pain. So that is dyspareunia, sir, for our viewers.
So all you men watching out there, watch out. It's not just that your wife doesn't want to have sex, but it's probably that she's got pain while having sex. And that's probably due to lack of lubrication. As simple as that.
Absolutely.
Okay, and as I said, we'll talk about the treatment part later. But
overall, sir, the quality of life definitely goes down during the post-menopause for every lady. How she copes with it, her educational background, her social background, economic background also plays a role in it. But overall, almost all the women, almost in the study, 80% of the women went through all these symptoms. Apart from the menopausal symptoms, these are just sexual symptoms that I spoke about. But menopausal symptoms are a whole plethora of symptoms altogether. This is whatever I have spoke now is about menopause and sexuality, the sexual symptoms.
Right. But tell me one thing. After menopause, there's no danger of pregnancy and the kids are by and large all settled. So the woman should be more relaxed. She should be able to enjoy sex more.
Yes, but like I said, the cultural context has to be noted. There are a lot of mood swings which she undergoes, the menopausal lady, she undergoes a lot of mood swings. There's a depression and anxiety which is associated with menopause and which is unknown. She doesn't discuss it neither with her family nor approaches a doctor in India, as far as India is concerned. So therefore, apart from that, a host of physical symptoms that she's trying to cope with. So along with that, so naturally she doesn't really think about pregnancy. She knows she cannot get pregnant. She knows that kids are settled and all that. But personally, she does nothing to resolve the issue. So once the issue is not resolved, there is discomfort, there's pain. Obviously, there is response is less. And there is more hesitation. And our culture itself, the culture and the society itself deems a lady who has attained her menopause as asexual.
Let me say, we doctors are also contributing to it. The gynecologists, they go to the gynecologist and gynecologist says, it happens to everybody. Forget about sex now.
Yes.
Instead
because
of
they are not sexual health specialists. They do not have that in-depth knowledge.
Exactly. So what we need to educate our audience, the public, is that there are specialists who deal with female sexual health. Somebody like you
And somebody
Because-
like you, sir, for in Delhi, I mean, sex is equal to Dr. Saxena.
Nice of you to say so. But what you need to do is to train more female sexologists with whom the
Yes.
average woman would be comfortable with. Now, what is the impact of comorbidities? One of the important problems that comes with age is that women have like arthritis.
Yes. So, as it is, women with arthritis, I mean, notifying the sexuality of patients with arthritis is of great importance for diagnostic evolution, control of pain, and fatigue, treatment and medication management that is often overlooked. All types of arthritis can interfere with daily activities. In this context, sexuality is one of the most important activities still neglected for a woman who is also undergoing arthritis. Fatigue, pain, motor restriction, depression, loss of self-esteem, that's another very important thing. Negative impact has a negative impact on the sexual life of a person's ability to enjoy sex.
Now, I'll talk about something which even doctors don't talk about, and that's the change of position that is required. Because the lady has arthritis, she's probably not able to open her legs. And if she does, then she gets pain for days after that. So the couple have to modify the position that they use in order to be kind to the limbs of the body. Your take on that?
Well, a change of position helps. Then using a water-based lubricant, that again gives some relief, along with a change in position, and also including natural products. Their diet modification, a little bit of lifestyle modification will help.
Okay. Sorry, Shamila. Dr. Shamila, we are completely out of time.
Yes.
So let's talk about it in the next video.
Yes.
We'll talk about the management of postmenopausal women. Viewers, you'll have to wait a little patiently for the next time we can get Dr. Shamila Majumdar to tell us more about what to give to women and men. But before you go, please press the like icon button and subscribe to the channel. If you have any comment or suggestion or would like us to discuss any topic on sexual health,
and
please
female
do so.
sexual health too.
Yes, and please do so in the comment section.
Please press the like button.
Yes, and do keep watching. Till next time, as the Duchess said to the Bishop, keep it up. Thank you.
Thank you so much.